Hi everyone, welcome back to my channel. This is Priya Physio. We are going to focus today on part 2 of problem solving skills, and today it's going to be more about scenarios of problems. Okay, so what kind of scenarios you could face in a healthcare environment as a clinician, as a healthcare leader? That's what I'm going to share with you. But before we go ahead, if you haven't already watched my problem solving skills part 1 video, please go and watch it because that is going to set your foundation for problem solving and what is required, what are the steps in problem solving. And let me tell you, it's like this. If you do a lot of that every single day, if you start applying and implementing those steps in your work area every single day, whenever the problem arises, in interviews, you're not going to be a different person trying to memorize answers. You will be able to follow and just answer it swiftly without having to think. And that's why these videos are so important. When I give you the steps in the first part of the video and then we go into the scenarios, using the framework, we will try to solve those problems. Hi, this is Priya Physio. If you haven't already subscribed to my channel, please subscribe now and hit the bell icon so you get live updates on when my videos are posted next. So let's dive in. So we are going to look at 3 scenarios today. Scenario number 1, which is going to be on staffing shortages. Affects most teams, most trusts, most private clinics, no matter where you are, whether healthcare or technical sector, this is what is the biggest problem. Number 2, conflict within MDT. MDT is a multidisciplinary team. And third scenario will focus on implementing a new process, implementing a new pathway or a protocol. So let's dive into the first scenario. If you remember the steps from the first part of the video in problem solving, you define the problem first, then you apply these 4 steps to solve that problem. So here we know that the scenario is going to be about staffing shortages. So defining the problem, are your team or your clinic or your area of work is short staffed. What is likely going to happen because you're short staffed? There's going to be increased waiting times. And number 2, there'll be reduced efficiency because your team or your physios, nurses, OTs they are trying to pick up more work than they can. And that's when mistakes happen. We all have to acknowledge that. We are moving from a culture of blaming to a culture of learning. Whenever you're trying to solve a problem, make sure you sit down and write down what is the real problem. What else is it affecting? What other teams it's affecting? It's not just your team, especially in the NHS. You all work together. So hospital discharges depend on how efficiently ward staff work, and discharge also depends on how efficiently patient is then transported from hospital to their community address like home, care homes, residential homes or rehab settings. And there how quickly and efficiently the other teams pick up. It affects the other parts. So you have to be really mindful of this problem and define it clearly. Now, step 1 is identify the problem. You have identified the problem. But here, you have to look into details of what is the extent of the shortage. How many staff are you missing on that day? Okay, number 1. Number 2 is what are the areas affected? Okay, areas. Now let's take a scenario of clinical setting. Your appointments will be affected. Your sessions, rehab sessions could be affected, or your administrative tasks like booking appointments, rescheduling, everything will be affected. So depending on which staff, how many staff, which type of, like, is it band 3s, band 4s, band 5s, or your admin staff, depending on that, you will realize what are the areas affected. And then this is what a leader would do. A leader would seek feedback from their staff. You will be going to your staff and saying, this is where we are. What do you suggest? How can we tackle this? And write it down. People and your team will step up more if you ask them, if you seek feedback from them of how are you feeling? What can we do? What are the solutions? And that's how staff, you're not only solving the problem or identifying the problem, because there could be other areas that are affected which you might have missed. So you will share what you have, as well as you will seek feedback and you'll ask your staff of what else do you think? Am I missing anything? That is not going to make you any less of a leader if you ask and seek feedback from your staff. So do that. And you're not only identifying a problem here, but you're increasing staff morale because they feel valued, they feel their voice matters. Okay, that's number one. Identify the step. Number two is analyze the options. So three things here. How do you analyze options? Now, because it's short staffing, you can look at immediate, like short term, what do you have to fix? In the medium term, what do you have to fix? And in the long term, what do you have to fix? Okay, so short term wise, let's go back to our framework on organization skills. Again, I have recorded a detailed video on organization skills. If you haven't watched it already, go and watch it because that will set your foundation for organization skills. So short term is you prioritize, you plan, and you time manage. That is organization skill. So in the short term, you'll prioritize patients and tasks based on their clinical need and based on the urgency and emergency of the situation. Next, you'll plan accordingly. If there are some patients which could be put back or some tasks that could be put back to the next day, yes, do that. And telephone appointments. If you think you have capacity to conduct telephone appointments and you can get to more patients that way, that's fine. So your quick reviews could be done over the phone. It is not going to be a setting stone that this is how you do it every time, but at least in the short term, you can be open and honest with your patients. And they really acknowledge when you're open and transparent. The problems happen or occur when you try to cover up things. Okay, so always be open and honest, they will be understanding. Now, if you can't book telephone appointments, assign somebody in your team or seek help from another team and see if somebody can work on your workload for that day to call patients and to cancel appointments. Okay, this wouldn't apply to every single scenario, especially for acutes. This wouldn't apply because you can't cancel appointments in the acute on wards, but everywhere else, a clinic could be postponed, appointments could be rescheduled, community, your visits could be cancelled, or your visits could be delegated to band 3s and band 4s. Okay, that's one. Medium term. What do you do in the medium term? You cross-train staff. Now, this is something that the NHS is really good at. You don't have to. NHS has set its policies in such a way that your band 5s, like band 5s and 6, your qualified staff, nurses, physios, OTs, are cross-trained to have basic competencies of band 4 of the other profession. Okay, band 4 level basic competencies of nursing and OT. So if you're a physio, you'll have basic competencies for uh, a band 4 level competency for nursing and band 4 competency level for OT. Again, there are some trusts which utilize their band 4s to do simple initial assessments like a walking aid prescription or a mobility assessment or a false review or a false appointment. Okay, those kind of things could still be delegated. So that's your medium term. So cross train them in such a way that tend to you tend to cover each other well. Now, long term wise, this is where you have to take some time. You are going to liaise with your HR and work on recruitment and retaining talent profile of the organization. So what staff you have, you don't want to overburden them so that they leave the job. And you don't even want to lose good people because the team morale is going down. So in the first step, when you engaged with staff, you actually helped with the retaining the talent because staff feel valued. They will be able to give the 200% to the team if need be. And start flexible hours, see how you can apply flexible hours in your area of work and provide mentorship opportunities for staff. So this is what you would do. So your options, you'll analyze the options and see what suits well for the team. Now, going to the third step, which is implementing the solution. How do you implement a solution? Right. Number one, a team meeting. A team meeting to showcase to your team or to share with your team the problems you've identified, the problems they identified, what options you've analyzed, what are your short-term, medium-term, and long-term fixes, what have you planned, and then tell them, or based on the analysis of the options, this is where we are, this is what we've got, and seek feedback actively. Don't just go in there and approach in a command and control style. Build a collaborative approach, work with them. That's when You will have a better team morale and better solution. Redistribute their workload. You don't want to overburden a particular team member with more work because they're efficient. That's why you have to be really careful and ask them questions of, what do you think? Do you think we can take one more assessment a day? Or do you think you can do two more reviews in a day? What help do you need? Can we go and can we delegate to another team? Can we seek help from another professions? Ask that. If you don't ask, you don't get. And digital innovation. So find innovative solutions of for the problems and options you've identified. And last step is evaluate the outcome. Anything that you have implemented, it needs to be evaluated whether it's sustainable. Sustainability is something where people fall on and quickly, before even they realize, they are back to their previous level. For example, staffing shortages, struggling team, that's where you're going to be back to square one if you don't evaluate and sustain. So how do you do that? Monitor patient wait times. With all the solutions that you've implemented, monitor wait times, seek active feedback from staff as well as patients, so you understand the quality of care. Number two, you continuously adapt. It is not something that's fixed, a new process, a problem has been solved, this is how we do it, this is how it works. No, it has to be iterative work. It has to be adaptable, change, okay, as circumstances arise. And staffing solutions. Find long-term staffing solutions. See if they are working. See if the cross-training is working. See if the delegation is working. And that's how you continuously improve. So this was about scenario one, staffing shortages. So define the problem clearly, identify the problem, analyze the options, implement the solution, and evaluate outcome. Let's move on to our second scenario, which is conflict within MDT, multidisciplinary team. Again, same 4 steps, same framework. Define the problem, identify the problem. First, you define the problem, then you implement the 4 steps. Identify the problem, analyze the options, and implement the solution. Evaluate the outcome, sustainability. Now, what is the problem here? There is a conflict between the team. Why do you think a conflict could arise? So, a conflict could arise between professions. It could be between physios and other professions because of differing treatment options, poor collaboration, broken communication between the team, and care issues, so patient care issues. There could be numerous problems. So you have to define why there is a conflict within your team. And you will be the best person to do that if you know what is the dynamics of your team. That's the problem. Now, how do you identify a problem? Okay, as a leader, you would observe interactions between your team members. See if there are any clarity issues with roles. So, with cross training, do you think a profession is being overburdened with other professional tasks as opposed to their core profession? For example, if you're a physio, are you being overburdened by doing nursing or OT tasks more as compared to your own core physio tasks? And that is likely to bring team morale down, and it's likely to cause friction. So you have to be a really curious observant and see how it's going on. Any communications barrier, especially when a person feels that they have communicated, or they assume that somebody knows how to do certain things. And if you don't ask, if you don't paraphrase things, it is likely that communication is going to be broken down. Okay, so understand the communication barrier. There could be a new member in the team who doesn't understand the team as much as you think. And that's when team starts thinking this new person is not good because they're not on board and they're not doing X, Y, Z. But has anyone given them a handover of how it should be done? Has anyone inducted them? A proper induction? That could be the communication barrier. And it's your duty as a leader to understand that. Number 2, feedback privately. Now, this is my ethos. Okay. Praise in public, feedback in private. Always remember, praise in public, feedback in private. And always follow the LEAPS model for conflict resolution. LEAPS is listen, empathize, ask, paraphrase, and summarize. That's the LEAPS model for resolving any type of conflict. Okay? So whenever you are in that meeting and you are providing that feedback privately, you would follow this LEAPS model so that you are listening. Show your body language that you're actively listening. You're empathizing with the person, with your emotions, with your facial expressions. You're asking questions to clarify and show that you're listening, but you're trying to understand the situation entirely. By paraphrasing, what you're doing is you're not assuming that this is what they said. You're paraphrasing in a way, and you're saying, is this what you said? This is how I've got this. Am I right? Okay. And then at the end of the meeting, always summarize that this is what we've discussed and this is going to be the outcome. This is what we are going to do. Step number 1, 2, 3. That's how you summarize something. So you both are clear when you come out of that room. And again, other contributing factors. This is third step of identifying the problem. Other contributing factors like workplace culture, leadership. Is leadership a problem? Okay. Many times, if leadership is not efficient enough in the team, or if there is a power struggle in the team, it is likely that the problems could arise like conflict between teams. And is it a system inefficiency? So you've looked at one person, so break it down again. People, leadership, organizational culture. Okay, that's how it is. So you look at your staff, you look at a team, you look at the leaders, and you look at the whole system as the organization. Okay, and that way, if you have these small models with you, you won't miss anything. Now, how do you analyze this? Analyze the options for this particular situation. Okay, be a mediator. Follow with structured discussions for any concerns and seek solutions. Okay, so be a mediator. You are going to be there as neutral as you could when it comes to a conflict within a team. Clarify roles. When it comes to clarifying roles, job descriptions really help. Okay, there are competency levels as well. You can share that, and you can share the decision-making process. And governance. Governance is a process that efficiently manages area of work. Okay, so you could have your own governance process. If you don't have governance processes, start with building one now. Okay, make sure you have a robust governance process to then understand if in this situation, these are the steps to follow. If this problem arises, these are the steps to follow. Okay, and that way, if it's clearly documented under a governance protocol, it is unlikely that it could cause a bigger problem in the future. And team building always helps, and my favorite. Okay, it doesn't always have to be within work hours. If you're a really efficient leader and if you really want to bring your team together, we all know we work in different shifts. Some work in the evening, some work at night, some work on weekends, some work during days, they have commitments, etc. If you can't make it during work hours, make sure you plan a team meal. Take your team out for a socializing event, and that's organize Christmas parties around Christmas. Okay, and that's how you build your team. If you are already in a leadership team and if you can manage the team building activities, that's where you actually learn. And team building is somewhere where you can identify problems, see what's going on there, how is the communication broken down, and also what can you do to bring them together. Now there are various ways of you conducting team building activities. It can start with a very formal team building activity like look for insights profile of your team. Okay, there are 4 colors, blue, 4 energies, color energies, blue, red, yellow, and green. See what your team has. Okay, there are also some roles like some are completer finishers, some are innovators, some are implementers. You have to see, and some are decision makers, some are directive. You have to see if you have a balance of that in your team. Okay, now these are formal ways of team building activities. There are other ways where you can just go out socially and let them interact more, let them share their personal lives, let them share their problems. That's how you build a team. Okay, so that's what you do with analyzing the options and implementing the solution. Okay, organize a meeting to address concerns, set a plan, and collaborate with your team. Build collaboration between the professions by addressing concerns with everyone in the room. All professions are in the room. You're setting a plan. You're saying, this is what I have done. This is what we've done so far. And this is how we think you should collaborate and seek feedback. See what they say. Patient-centered care. Always focus on patients are at the heart of everything we do. It's not about you. It's not about me. It's about patients. We are there for a reason. And everybody has the same reason in the healthcare. Go back to your organizational values, revisit your organizational values and see if your staff and your team is aligning with the organizational values. If they are not, you've got to redirect them to organizational values. And last one is use structured communication tools. For example, handovers, templates to make their jobs easy. Okay, governance process, write down the process. Okay, that's how you implement solution. And for example, if you have different shifts, you have to understand in a handover, this is what you should cover. Because some people would give a paragraph and some people give a page full of handover. So you have to be consistent with that. So that some people might feel I do a lot. Some people feel that's fine. This is enough for you. So it's different personalities. If you standardize something, standardize it properly. And fourth one is sustaining, evaluating the outcome. So whatever you've implemented, what's happening with that? So conduct regular check-ins with your team. You can do it profession-wise, or you can then bring them all together and do regular check-ins with them to see what's the team morale like. How do they feel? And there are various tools that you can use here to understand the morale of the team. Various online free questionnaires you can use. And even better, get in touch with your people development or organizational development team within your organization and see what they have to offer. Even they are happy to come and conduct a session for your team. And they will run that particular survey and they will make sure, sorry, it's my phone. I should have put it on silent. Sorry about that. So make sure that you have regular check-ins with your team. And when it comes to communication, always remember, open communication, open and transparent communication helps more than anything. And you as a leader, if you show adaptability, your team is likely to follow you because you're role modeling that. Change is difficult, always difficult. Okay. If you think change is not difficult, if change is easy, then try sleeping on the other side of the bed for one day and see if that change is something that your partner will like or even you. Right. So this is our scenario number 2. Let's go to our final scenario when it's time to implement a new process or a new pathway or a new protocol. Again, same thing. Define the problem and follow your 4 steps. So what are your 4 steps? Identify the problem, analyze the options, implement the solution, and evaluate the outcome. Define the problem. Okay. New process. What is happening? So what type of change is that? What is the new process? Is it a new documentation system? Is it because of new guidelines that have been published recently nationally? Is it organizational guidelines that have changed? Okay. And is it an administrative process? So you have to see what is the exact problem. If a service undergoes a change, service improvement, or if there's a new process, you have to understand that it has several aspects to that. Sometimes it affects patients and clinical care. Sometimes it doesn't affect it at all. All that changes is your documentation. For example, if you have been long enough in physiotherapy and in the UK, you would understand when there was a switch from paper or handheld notes to System 1 for community. Okay, and that's how that's like a new documentation system where you're not going to write your notes anymore. You don't have to come to the office anymore. You can work remotely and you can do your notes on a clinical database. Okay, that itself is an example of new documentation system. Now, what's the problem here? Identify the cause. What is the cause? Is it system, overall system? Is it the training? Have they not received? Let's take example of new documentation system, like transition from paper notes to clinical database. Okay. So is system a problem? Can they follow the system? Training. Have they been sufficiently trained? Has there been a support when they start? So for example, it was going to go live in say 1 month. It went live. After it went live, do you have any support if people face any problems, training issues? And can you sustain it? Paperwork wise, is there enough paperwork? Is there enough guidelines or guide of what to do and a troubleshooting kind of troubleshooting? So see what's the cause. So is it system? Is it training? Is it paperwork? What is it? What is the problem here? Have you set it properly? Number two, gather feedback. Always gather feedback. I think identifying the problem in all three scenarios, we've consistently noted that we are seeking active feedback. And outcome measures. Now, make sure you have outcome measures and metrics and data right from the beginning. Because you're going to analyze a process, make sure you document before the process was implemented. Okay, it could be a survey, it could be informal feedback, it could be in team meetings, and then you can use that data after the process has been implemented as a post survey, so post implementation survey. So that's why your outcome measures, your metrics and data is key, especially when it comes to new process. Number two, analyze the options. Okay, again here three: short term, medium term and long term. Okay, what can you do in the short term? Again, because it's a new documentation system, I think let's take that example throughout now. Is extra training required? Okay. If yes, how can it be provided? Can it be provided virtually or can it be provided in a room face to face? How do your staff feel comfortable? What do they feel comfortable with? What do they think is going to work for them? Medium term wise, modifications to protocol and automation. So always implement, wherever possible, have automations in place. Okay. Wherever possible, if automations are in place, people know exactly how to troubleshoot the problems. Now, this is likely that once the system has been implemented, okay, how do you modify to that protocol? Can you modify the protocol? And how can you put automations in? Automations as in, how can you automatically solve problems by using the troubleshooting guide? Now, long-term wise, evidence-based feedback to your senior management team and review solutions and protocols. So always be open and honest with your senior management as well, because they might think that this system is excellent and it's going to work and we have to make it happen. But you are working with frontline staff who are actually going through that process of change. And you'll have to see that you have evidence base, which your data is going to provide in the problems. Okay. And that data will talk more than you talking. Okay. And review solutions. See what all solutions you've got and see which one works for your team and follow the protocols. Now, this was about analyzing the options. Step 3 is implementing the solution. Introduce time-saving hacks. You're implementing a new process. Okay. So time-saving hacks like use templates where possible with clear framework and with clear headings. Adjust workflow. Okay. Adjust how your work arrangements are for your team. Okay. And adjust workflow accordingly. Process champions. Amazing. I love this. I used to be a champion. I'm still a champion. So every time, whenever you're working, and if you can introduce champions to take that work forwards, these are the experts with passion in that particular field. So they are going to be there to solve the problems if the training provider isn't going to be able to do it. Okay. And pilot the new process. Always remember, always pilot a process before going into the details of any process. Okay. Pilot is where you do a shorter duration implementation of that solution. So if it's a new documentation, why not pilot it for 6 months and see if it works? Take a small group of physios, a small cohort of caseload, and do it and see if it works. If it works, well and good. If it doesn't work, try to find a answer for why has it not worked. What have we missed? And last one is evaluating the outcome. So measure success, always measure your success with outcome measures. See what went well. See what happened. Has it been successfully implemented? What has changed? Okay. What was good? What was bad? So measure your success with using different templates and metrics. And staff feedbacks. Always seek staff feedback because they are the ones who are actually implementing the change. They've gone through the new process, they've learned a new process, and now they're implementing. So they will understand how it was working before and what has changed now, and is it easy enough. Senior management involvement is the must, especially when it comes to new process. Because if they know how you're implementing the processes, what has been successful, what hasn't, and what your staff have already tried, they will be more inclined to then look for possible solutions and options or put in more training in. More training means more funding. More funding means your senior management has to seek some sort of funding from somewhere with the tight financial envelope that everybody has to work with. Okay. So these are the three scenarios that we've discussed today. I hope this was useful. And if you've realized in all three scenarios, there was a common thread that was going through. In every single scenario, we had the same framework. I defined the problem, identify the problem, first define the problem, then apply the 4 steps of identifying the problem, analyzing the options, implementing solution, and evaluating the outcome. Now, the more you do it and the more you listen to this, it will just become second nature for you. You won't even have to think in an interview when you're trying to answer a question on problem solving, because whenever there's a problem in your head, quickly you'll make sure you'll have your example ready. That's how you need to be prepared for interview. But you'll quickly think how you'll define the problem based on what problem or scenario you face at interview. And then you'll think, okay, identifying the problem step, what do I do there? Analyzing, implementing, and evaluating. Okay. So always remember, a framework in your mind helps you really well. And here's a trick. Okay. And that's a really useful interview tip. Okay. That interview tip is, don't jump to answer questions immediately. As soon as you hear the question, don't hurry and just say, this is what I'll do. Take a pause. Normalize the pause. Don't have to do okay, you don't have to use those filler words or actually, basically, don't do that. Stop. Okay, you can make a thinking gesture. Make a thinking gesture so that they know that you're thinking over something, thinking over that question. And a few seconds of pause, like 4-5 seconds pause. And then in that 4 to 5 seconds, you have the framework defining the problem, step 1, step 2, step 3, step 4, and then you quickly put things in place and you start talking. When you start talking with this type of framework, with this type of mindset, you're likely to then understand, if you're likely to go over your framework, so you're not going to be digressed. Okay, and this is the best way to answer in an interview. Okay. If you don't have a framework, you won't understand where you started and what you spoke a lot about and what you haven't touched on at all. Okay. So always a framework as opposed to no framework. Have a framework in mind. Normalize, pause. Pause. Have a sip of water. While you're doing that, they know you're doing something, but you're thinking in your head of how to apply that particular process or framework to the question that you have been asked. Okay. So this is our video on problem solving. I hope you've liked, and I hope this helps in your interview scenario, and hope it helps you to understand the basic framework of problem solving. And the more you practice, the better you get at it. So even if you don't have a problem at work, even if you're not in a leadership role, try to use this framework so you get used to problems. And there's at least one question in the interview, either on conflict resolution or problem solving. Okay? Either of those, apply the framework. I've also given you LEAPS model. If you have not heard it properly, go back. LEAPS model is for conflict resolutions. You can use phrases in the interview to answer. All you have to do is be there 100% and set a framework in your mind before you open your mouth to answer. So this is your Priya Physio signing off. If you haven't already subscribed to my channel, please subscribe to my channel now and hit the bell icon so you get live updates of when my videos are posted next. Next week, we'll come back with a new theme. Stay tuned. If you haven't already started following me on my social media platforms, please follow Priya Physio at Priya Physio UK